Chairman, Ranking Member. You know, I sit here and just think just a second, but not very often do I have this opportunity, you know, because Dr. Kane, I can't tell you the number of times I've been in the Andrews Institute, and I'm sure you know that.
Yes, sir.
And Dr. Legg and I are long-lost friends and everything. And Coach Hasselbeck, you know, I've watched you forever, and you're a coach, and I love it in every way. And that only leaves Jennifer, the only one that I'm not really in contact with. But Jennifer, thank you so much for all you do in your wonderful state of Massachusetts and everything. And I've got Coach sitting right here beside me, and he's probably wondering what in the world is he going to say. But here's what I would say, and this is all there is to it. My job right now is to introduce a man that absolutely is a superstar in our state. Dr. Paul Legg. You know, believe it or not, we graduated from the same high school. He was probably higher in his class than I was, but nevertheless, a great, great, great man, an incredible physician. The people of our state depend on this man like you can't imagine. And especially, I'm sure, the elderly, but many, many, many in our state have visited and been recipients of his unbelievable care. You know, Doc, you know me and you know me really well. We had so many interactions with COVID. For 8 years, I was the governor, and through COVID and all that was a lot of situations to where this man rose to the level of a superstar in my eyes in every way. There's no way I could be prouder than to introduce him today. A West Virginia University graduate, an absolute graduate of the same high school that I went to, Woodrow Wilson High School, and absolutely a superstar in our state. So Dr. Legg, take over and take it from here, sir.
Chairman Scott, Ranking Member Gillibrand, and honorable members of the committee. My name is Dr. Paul Legg, and I want to thank you for the opportunity to offer testimony to the Special Committee on Aging. Thank you, Senator Justice, for the introduction, and go Flying Eagles. I would also like to thank my wife of 34 years, Lee, for her support of me and my career. My daughter, son-in-law, and granddaughter are here today, and my son and daughter-in-law are watching from South Carolina. I'm grateful for their support as well. I'd also like to state for the record the opinions expressed today are my own and do not reflect the viewer position of my employer, Charleston Area Medical Center and Vandalia Health. I'm a practicing orthopedic surgeon in Charleston, West Virginia, having spent 27 years in private group practice and the past 2 years as a hospital-employed surgeon for Vandalia Health. I'm board certified by American Board of Orthopedic Surgery with a certificate of additional qualifications in sports medicine. For over 20 years, I've also been a team physician for the University of Charleston, an NCAA Division II school with approximately 620 athletes. Sports medicine encompasses the prevention and care of musculoskeletal injuries and medical conditions encountered in sports. The lessons from the field, operating room, and research are applicable to maintain physical function and performance in competitive athletes of any age. The health outcomes of seniors improve by keeping them healthy, active, and injury-free as they age. Surgical techniques designed to return competitive athletes to the field of play can also benefit seniors with similar injuries. However, surgical techniques are only a small part of sports medicine's influence on senior health. The manner in which our athletes train and prepare offer many more lessons on improving the health outcomes of seniors. According to the 2022 report by National Health Statistics, only 13.9% of adults aged 65 or older meet federal activity guidelines. The environmental factors to low physical activity are many: cars, mobile devices, sedentary jobs, elevators, computers. Since people get very few adequate exercise at work or throughout their days, exercise needs to be added as purposeful activity. Fitness is partly genetic and measured by how far you go on an exercise test. Physical activity is behavioral and requires motivation and commitment. Increasing your physical activity will increase your fitness. For example, walking is a low-intensity exercise and an appropriate start for most seniors. Poor physical activity and nutrition top the list of the most common health issues encountered by seniors. As we age, our fitness declines. However, exercise can prevent this decline in many patients. Strength training is one of the activities that can improve health outcomes for seniors. The established benefits of regular strength exercise include strength and endurance, increased muscle mass, increased resting metabolic rate, and preventing disability. Both research and experience indicate that resistance training is safe for healthy older adults, for frail older adults, and individuals with disease. Muscle disuse is a preventable and reversible factor. Resistance training is consistently shown as feasible and effective means of counteracting muscle weakness and physical frailty. It improves bone density. It improves metabolic health, insulin sensitivity, as well as improving psychological well-being and reducing the risk for falls and fractures in older adults. So what behaviors can we encourage in senior adults to help start and maintain an exercise program? The first step is making a commitment to increase physical activity. They have to establish protected time to forgo other activities that may encroach on the scheduled time. Set small and realizable goals for exercise, but also think about and establish long-term fitness goals. These barriers must also be addressed. That includes lack of understanding, lack of awareness, and unfortunately, lack of motivation. As I've seen in almost 30 years of clinical experience, health outcomes in seniors can be improved with the lessons we learn from sports medicine and sports science. It's the planned and purposeful exercise and strength training used in preparation for competitive athletic events that provide a structure for exercise in senior adults. Advanced training techniques can also move senior adults from just physical activity and into increasing levels of fitness. Thank you, Mr. Chairman. I look forward to answering your questions.
Thank you, Dr. Legg.
Any of you, but I really am always intrigued by just this. You know, Dr. Kane, you at the Jimmy Andrews Institute, you probably have many stories to tell. And with all that being said, I'd like you to just elaborate, if you could, just on this. Over the years, you especially have seen so much progress being made towards our seniors and what can be done. So just elaborate in your words. Your experiences with Jimmy Andrews, I know, are just limitless. But absolutely, in my opinion, you know, Jimmy is a terrific friend, been a friend forever and a day. So please tell us more.
Thank you, Senator Justice. Dr. Andrews has been a great mentor to me. And, you know, Dr. Andrews retired 2 years ago and is now kind of in a stage where he's trying to take care of his health more than he used to instead of working so hard. And you have a great point. I mean, we have had great advances in sports medicine, taking care of teams, and medicine in general over the past 30 years. But the reality is, I think in medical care of our older patients, most of our time is spent dealing with complications on the back end. There's very little time spent on preventative care. And if you take the typical primary care physician that sees an older patient, internal medicine, family practice, or another physician, they spend most of their time dealing with heart disease, high blood pressure, and other things that are already kind of the cat's out of the bag and they're just trying to manage. I think the way we get on top of this and the way we treat this better is we treat our older patients just like we treat our younger athletes. We try to work on preventative programs, things like Ms. Raymond's doing, and we spend more time with our office visits talking about how to prevent disease than how to treat diseases the patients already have.
Well, I know you're doing unbelievable work, and, you know, I can tell you the many visits that I've had there have ended up, you some way, somehow patched me together, and I've made it this far anyway. But, Matt, I've got to ask you just this, you know, not to not ask Dr. Legg wonderful questions but Dr. Legg and I have been around many times on many different things. Matt, I watched you play. You were a superstar. You have absolutely a family of thoroughbreds like you can't imagine. And through all of that, you have a message to pass on to all of us. and all the different things that you know that we can do better at. You took care of yourself. You took care of yourself in a really proactive way, and you're exactly right. NFL athletes don't usually stay there long, and you stayed there forever and a day and made a contribution every single time you went on the field. But tell us more. Tell us more about really what we should be doing. I listened intently to all the different folks in your family and all their incredible accomplishments. Now I want to hear from Matt. Matt, what do you think we really need to be doing?
Well, thank you for your question. I mean, I really agree with what both doctors said about being proactive, stability work, falling. You know, at football, running backs don't want to fall because you're down. So you practice balance all the time. You practice with your eyes open, you practice with your eyes closed. That's something that I would do as a quarterback. It's something that I would do with my mom. She would do with her mom. I think these are lessons, you know, using some of the injuries that are common for quarterbacks. A high ankle sprain is an injury that you have. We would do what we call prehab. It's preventative rehab. We would do the rehab as if we had an ankle sprain, a high ankle sprain, before we even had the injury. Or even coming back from my one surgery, which I had down in Alabama, which was not convenient living in Seattle, but it was great and it was successful. But one of the things that we did with the athletic trainers, we practiced falling. You know, I went from being in a sling for many, many weeks to I had to somehow get from the sling to back on the football field, getting tackled by guys like Michael Strahan. And what are we doing in the meantime to get there? Practicing falling was really a great return to play protocol that helped me coming back from surgery. When I felt frail, I felt afraid to fall, but doing it in a controlled environment is one of the things that gave me confidence, gave me athleticism, and got me back to feeling like I could go protect myself in the arena of athletics.
Thank you, sir. And I practice falling right now, but it's really not on purpose. Anyway, thank you so much, sir.